Good day, everyone. I am Dr. Justin Ho. I'm a pediatric infectious disease specialist, and I'm here to give you update regards to COVID-19 and what we need to know. So, as for my outline for today, these are the topics and highlights that I'm going to cover. First and foremost, what is COVID-19? Okay, what we know so far about it. Is it transmitted? Symptoms? Who are at risk and how to classify these people. Okay. Next would be COVID-19 testing and considerations. And lastly would be your management and prevention. So COVID-19 is the disease caused by a new coronavirus called SARS-CoV-2. And the WHO first learned of this new virus last December 31, 2019, following a report of cluster of cases of viral pneumonia in Wuhan, People's Republic of China. So as we can see, it is a beta coronavirus with spike proteins, and it is actually known to infect the upper respiratory tract. So which explains the majority of its symptoms being fever, cough, and colds. Okay. So the relative size of these coronavirus particles, okay, it being zero point 0.1 to zero point 0.5 micrometer in diameter, okay, is actually a very tiny particle. So this is comparing the particle with all the rest of the particles that we see. It's actually not visible to the naked eye. Okay, thus there are a lot of findings with regards to its transmission being aerosol or droplet transmission. Okay. So as you can see, it is very, very tiny compared to all the rest. Your beach sand, your human hair, okay, even a grain of salt is actually even way lesser in its diameter. So worldwide, as of November 3, 2021, this was coming from the World Health Organization. Okay, we have already reported as high as 247,472,724 total cases in the world. And the total reported deaths is around 5 million already. So as for the situation by WHO, okay, the US remains to be on top, okay, followed by Europe and Southeast Asia. So the Philippines is contributing to the number of the cases that we see in Southeast Asia. So as for the nationwide cases data, okay, this was as of November 3, 2021 in the Philippines as reported by DOH. Okay, we have reported around 1,591 cases, okay, and we're averaging around 1,500 to 2,000 to 3,000 cases per day already. So this was coming from a spike a few months ago, last August to September, we had spikes of cases. Okay, and as we can see now, the cases are relatively decreasing already. So in the Philippines, we have already reported also 2,793,000 cases, and a lot of these cases have recovered. Okay, and a number of these patients have already died. Okay, and or their deaths were attributed due to COVID-19. Okay. So take note that these cases were the reported ones coming from RT-PCR positive cases. Okay, so as for the other data, what we can see is the top region contributor would be still the NCR. Okay, next would be Calabar Zone, Central Visayas, and Western Visayas. So if you could see here, we also have the top provinces and cities contributing to these cases: Quezon City, Cavite, Laguna, Bulacan, and Rizal. So all the rest are actually contributors also. And as for the testing, we have already seen an increase in our testing capacity. Okay, as we can see the trend here at the right. And as for the weekly positivity rate, okay, it continues to decrease. Okay, as low as less than 10% already. So this was coming from a high of more than 20% the past few months. Okay. So what is the current scenario? So based on the data that we're seeing, we are already getting a relatively lower and decreased number of cases here, but surges still remain to be present in some areas. So worldwide, we are also seeing some surge in other countries as well. Okay. Next would be that COVID-19 variants still continue to emerge. Okay, despite the Delta variant, we've been seeing a lot more variants of interest uh, in other parts of the world, and we can continue to expect a lot more variants coming in soon. Okay, as a pediatric infectious disease specialist, okay, these past few months, we've been also seeing more pediatric cases. Okay, most of these cases were actually mild. Okay, and a small proportion are the severe ones, but in general, okay, we've been seeing more cases still with adults. Okay, as we can see the situation now, more people are also going out. Okay, as for the traffic situation, we can see a lot more vehicles along major roads in the NCR, and this is actually expected to increase further, as reported from this was taken from Rappler. Okay, so currently we all have to know that many research on COVID-19, especially on vaccines and boosters, are still ongoing, and a lot more medications are also under research and investigation right now. So as for the variants, since they still continue to emerge, okay, we have these variants of concern being attributed to increase in transmissibility, okay, or increase in virulence, or change in clinical disease presentation. So the Delta last August 31, 2021, okay, the WHO said that the Delta was now the dominant COVID-19 variant in the Philippines. So what we know about the Delta variant is currently it is the fastest, fittest, and most transmissible variant among the rest, and it actually has a shorter incubation period. Okay, so there are a lot more variants, but these are variants of interest, okay, which we still have to monitor along the way. And with the development of new variants, of course, definitely our country needs to be testing a lot more and actually be undergoing genome sequencing of their RT-PCR tests. Okay, just to be able to be sure that we're actually getting uh, a significant number of or reporting a significant number of a specific variant. Okay. So basically, for as we move on to the transmission of this virus, we have seen that it is actually a very tiny particle. So napaka liit po talaga nung particle na hindi talaga siya nakikita. Okay, before it was known to be coming from animals, but later on, the transmission was made, no, was established through person to person spread already, and this was coming from respiratory droplets. So, the mode of transmission would be through coughing or sneezing, and there were concerns with regards to uh, aerosol transmission. Well, because napakaliit talaga nung size ng virus. So, pwede talaga siyang ma-aerosolize, especially in enclosed spaces. Okay, for the mean incubation period, what is known now is that it is actually around 4 to 5 days, but the range uh, can go as high as up to 14 days. So the transmission of this virus can be through close contact, usually if less than 1 meter. And the studies show that people, okay, are most contagious, okay, when they are most symptomatic during their course of the disease. So what are the signs and symptoms of this COVID-19? So of course, fever, okay, being the most common, fever and cough, lagnat, with may temperature na more than 38. So cough, usually dry cough, ubo, okay, shortness of breath, diarrhea, colds, fatigue, okay, parang pagod, panay pagod, headache, sore throat, chills, loss of smell. So medyo kumpara po sa ibang disease, no, this COVID-19 actually can encompasses a lot of symptoms, and it's really hard to rule out COVID based on the symptomatology. Okay. So who is at risk? So at present, the data that we have is that the elderly and people with existing pulmonary conditions, those with underlying comorbid illness such as heart, lung, or kidney diseases, those with hypertension, diabetes, cancer, and obese patients are really known to be at risk of this disease. Okay. So for the classification, okay, what we can see is that it can be classified through suspect, okay, being a patient that has fever or other symptoms with COVID. Okay, probable would mean like we have other labs pointing to COVID, no, plus symptoms or even exposure to a close contact or probable contact patient. Okay, and the confirmed one would be the patient that has laboratory confirmation. So it's usually the RT-PCR that is con- confirmatory of the COVID-19. So as for the close contact, okay, what we have here is the definition is that it's an individual na exposed, okay, 2 days before or within 14 days from onset of symptoms of a confirmed or probable case. So even before nagkaroon siya ng symptoms, it's important, no, to note that the 2 days before, okay, yung taong yon or nakasalamuhan yon na probably nagka-COVID-19 ay posibleng pwede talaga kayong nahawaan. Okay? Okay, face-to-face contact with a probable or confirmed case within 1 meter or for at least 15 minutes. Yan po yung cut-off time. Okay, direct physical contact. Magkaroon ng talaga ng contact with a probable or confirmed case. As for the healthcare worker, those who are in direct care for a patient, okay, with probable or confirmed case without using the recommended PPE. Of course, by using PPE, we could actually lower the risk already for all our healthcare workers. So other situations as indicated by local risk assessments. So as for the severity classification, what we can see is it can be classified kung non-severe, meron tayong mild to moderate, okay? Yung mild being wala silang pneumonia, okay? May acute onset of fever, may cough, no? And actually other symptoms, okay? Pero stable yung patient, yeah, wala na pong ibang nararamdaman. When you say moderate, wala rin siya, okay? Pero may signs ka ng pneumonia, may it be sa x-ray. Pero clinically, when you see, hindi naman daw siya hirap, okay? And of course, ito yung medyo nasa gitna, no? When we talk about elderly and those with comorbidities, with actually lean towards labeling them as moderate, no, onwards. Kasi sila po yung mas at risk. Another category would be your severe to critical. So these are the patients being hospitalized, and these severe to critical patients, those having pneumonia, those nahihirapan huminga, okay, nangangailangan ng oxygen, sila po yung kailangan pong magkaroon ng hospital management already. Okay. So for the critical, it just says that these patients are already uh, having multi-organ failure, nagkakaroon na talaga ng mga problems sa ibang organ systems po nila because of COVID-19. So what happens to these people who get COVID-19? So among those who develop symptoms, most or about 80% recover from the disease without needing hospital treatment. And about 15% become seriously ill and require oxygen, and 5% become critically ill and need intensive care. So what we can see is that some can also develop complications, so respiratory failure, hirap huminga, acute respiratory distress syndrome, nagkakaroon sila ng sepsis, multi-organ failure, minsan apektado na po yung puso, atay, or yung kidneys. So in some rare situations, yung children naman can develop a severe inflammatory syndrome a few weeks after infection. And this is what we call multi-inflammatory syndrome in children. So, in my practice, I have seen some cases already of MIS-C. Okay, so as concerns with regards to long-term effects of COVID, ang nare-report ngayon is usually after a bout of COVID-19 infection, meron pa po tayong mga patients who complain of fatigue, mabilis silang mapagod, may iba nagpapalpitate, some have respiratory and neurological symptoms. So currently, we're still investigating these occurrences. Okay. So moving on to your COVID-19 testing. So currently, what we have are, of course, the RT-PCR or molecular tests that are available. So this is actually the gold standard, because of its high sensitivity and specificity among all the tests. Okay, we have antigen and antibody tests, and we also have other ancillary tests. So like your CBC, X-ray, chest CT scan, which can support COVID-19, and other inflammatory markers such as CRP, ferritin, LDH, okay, procalcitonin, uh, that are requested. Okay? So in general, anyone with symptoms should be tested whenever possible, and people who do not have symptoms but have had close contact with someone who is or may be infected may also consider testing. Okay? So of course, while waiting for the test results, no, yung mga na infect, of course they should, or those who have symptoms should remain isolated from others. Okay? So in a lot of these areas, I'm sure marami tayong questions with regards to ano yung best test na pwedeng gawin, and of course the timing and all that. Okay, so in my next slide, I'd like to discuss that there are a lot of considerations when you talk about testing. Of course, number one, ano yung objective nyo sa pagpapatest? Okay? Knowing na, especially now that kapag nagkaroon na ng positive test, no, we usually double think as physicians whether we would need a repeat test already. Kasi nga, meron pa po tayong mga concerns with regards to some patients having persistently positive RT-PCR test. Pero po, beyond na po siya dun sa uh, recommended duration of isolation, or even magaling na po siya, wala na po talaga siyang symptoms. So, aside from that, ano yung right test for the patient? Meron talaga tayong, of course, case-to-case yan, but the PCR still remains to be the most utilized and best test to do for COVID-19 confirmation. Ano po yung specimen na pwede nating i-collect? Kasi meron iba oral, iba nasopharyngeal, but in the studies, nasopharyngeal is still has high accuracy compared to all the rest of the specimens. Okay, methodology, of course, affected rin yan kung paano kinuha, gaano kagaling yung pagkuha, and who to test. Who to test, sino pa yung mas kailangan i-test, okay? Uh, Between someone who is symptomatic versus an asymptomatic patient, sino yung mas kailangan i-prioritize. Best time to test. As for the best time, no, of course, kaming mga doctors, we really consider the onset of illness kasi nga we have a lot of considerations with regards to the timing. What the test means, okay? What is actually the test site and the release period. So, itong table na to na nasa right, okay, just a sample of all these tests and all these factors, no, playing, no, that we have a lot of considerations. And a lot of this is currently what we have, but a lot more are still under going research studies. No, so hopefully we'll get a better test, okay, in the future for COVID-19. So, what's the difference between isolation and quarantine? So, both isolation and quarantine are methods of preventing the spread of COVID-19. So, pag para lang alalahanin natin, no, mas mabilis natin matandaan, isolation dun sa symptomatic na pasyente. Okay, to separate ill persons who have communicable disease, okay, to restrict movement. And for the quarantine, okay, it is anyone who have had close contact, okay? Hindi siya hindi siya nagkakaroon ng symptoms, asymptomatic, well persons, okay? We would still recommend them to do a quarantine to monitor during that time, no, or to see if they become ill. Okay. So kapag nagkaroon ka naman ng COVID-19, gaano po katagal yung isolation mo? Of course, for symptomatic patients having COVID-19 positive or are treated as COVID-19 probable patients, okay, usually ito yung nasa guidelines ngayon, 10 days after onset of symptoms for mild cases. Okay, for severe, moderate to severe cases, it's up to 21 days, so medyo mas matagal. Okay, for immunocompromised, okay, those having cancer or HIV, these conditions or yung duration of isolation nila may be more prolonged, okay? But of course, a lot of considerations would be dapat nagre-resolve na yung fever nila. That is actually 24 hours with no fever without using medications. Other symptoms are also improving. For asymptomatic, no, if yung mga patients nagkakaroon ng COVID-19 positive result pero wala naman silang nararamdaman, so we usually just count 10 days from the date of the positive COVID-19 test. So, moving on with the management, okay, of COVID-19, I can summarize this into four aspects. So, first would be your medications. So, for medications, what we have are paracetamol, supportive treatment. We currently have antivirals, no? Some studies are still ongoing with a lot of antivirals, but remdesivir is the one that is most commonly used, especially for those needing oxygen. Okay, so in the evidence, it is found to be beneficial, okay, if given for severe COVID-19 before mechanical ventilation, and it may reduce the length of hospital stay. Okay, some immunomodulators would also be actually helpful together with our antiviral. So a classic example would be your dexamethasone. So the patients that are given dexamethasone are those patients needing oxygen, okay, those who have O2 saturations of less than 94%. Okay. As for the other medications, we have monoclonal antibodies, tocilizumab being one example, okay, and a lot more experimental therapies. So a lot of these are still uh, ongoing, a lot of investigational research studies on these drugs. Okay. So next aspect of management would be your home care. Of course, ito yung home care. Uh, Talagang recommended naman to for your mild cases. No? Usually, they only need supportive care. So, a lot of, marami na rin tayong naging discussions on home care and how to do it. But later on, I'll discuss it. So, hospital management for our severe to critical cases. Okay, bakit nila kailangan? Because they need further workup. Okay, and then minsan nagkakaroon na ng komplikasyon like inflammatory syndrome, nagkakaroon ng sepsis. So these patients are really require hospital management. And the fourth aspect would be your contact tracing. Of course, part and parcel of our management would still be on the prevention, no? Paano nat Of course, yung contact tracing, paano siya nahawaan, okay, how can we prevent these incidents from happening again? May it be just a local transmission or even extend to community transmission. So as for the home care or home isolation, kailan natin sila pwedeng i-consider na pwedeng gawin? So patient is stable to receive care at home. Okay, of course, ina-analyze namin kung kaya ba sa bahay. Ideally, meron siyang separate room. Okay, may bathroom, access to food and other necessities. No? Appropriate caregivers are present, especially for the elderly, okay, for the handicap, or even for children, no, very minor sa nagkakaroon ng positive na kailangan talaga natin mag-assign ng caregiver. So, sino po yung mag-aalaga? Of course, dapat yung someone who is healthy without existing comorbidity, someone who does not exhibit symptoms as well. Okay? The patient and other household members must have access to PPE. So, yung minimum would be at least may gloves sa bahay or face mask, okay, and are capable of adhering to precautions. So, of course, yung informed, no, gusto natin yung caregiver yung maayos, informed on the precautions, marunong cough etiquette, okay, and of course, our very important would be hand hygiene. So, consider at-risk populations in the home, your seniors, young children, pregnant women, immunocompromised. Okay, important that you can also have access to your teleconsultations. And right now, yun nga, that this is what we advise. Dapat meron kayo emergency contact numbers. Okay, sino yung mga nearby hospitals nyo na pwedeng makontact. Ano yung mga hotlines nila. Okay, so that you can easily call them or contact them. So also knowing what to watch out for. So when do you actually seek medical care? So emergency signs warning, usually these patients have breathing problems already, have signs of respiratory distress, nagkakaroon ng new mental confusion, okay? Parang hindi nyo na siya makausap than before, bluish na yung face, okay? It may indicate na talagang pagod na lang siya huminga or hirap siya talaga huminga. Inability to wake or stay awake, hirap talaga siya, or persistent pain or pressure in the chest. So some really, may mga patients talaga na parang feeling nila pagod sila or hingal. So yun sila yung mga kailangan talaga ng further assessment. So I like this COVID-19 care algorithm that was shared. Okay. Kasi nga this actually guides everyone on how to do the home care and how to self-monitor at home. So, yun nga, I'd like to remind everyone that you should be able to be reading this, no, para ma-simulate nyo na rin talaga how you do it once you are exposed to a COVID positive uh, patient. So in the home, may it be in the community or in your workplace, usually ito yung ginagamit na guide. And I really find this very helpful. Okay. So last in my talk would be, of course, your COVID-19 prevention. And sa lahat ba naman, of course, prevention is still better than cure. So it also applies with regards to COVID-19. So very important, no? How do we stay safe, especially during this time? Okay, how do we stay safe? Okay, ito I've summarized it into four main points. So of course yung apat dapat or yung minimum public health standards natin, dapat talagang naka-face mask with face shield. Okay, we ensure that we are in a place where there's adequate airflow, air circulation, good ventilation. So pag naka-aircon kayo, mas maganda open the windows as well. You do physical distancing wherever you are, at least 1 meter or more. Okay, always use face mask and face shield. Okay, time of interaction, pag kinakailangan mag-interact with other people, okay, bawasan po natin to at least less than 30 minutes. So, madaling tandaan, apat dapat. Okay, the next would be enhanced workplace protocols. Of course, marami tayong mga nagtatrabaho, okay, mga pumupunta sa work, hindi maiwasan. And ito yung mga kailangan na ma-establish talaga sa workplace. And of course, marami talagang mag-iiba na because of we're ensuring the safety of all our workers, especially in this new normal. So quarantine and contact tracing would be really part of the prevention, no? Para lang ma-decrease yung cases. And of course, lastly, our vaccination. So, of course, I'd like to educate everyone on the proper wearing of our masks. So, marami rin ako sa nakikita naka-mask pero naman nakasabit lang or minsan nilalagay sa noo. Okay? Hindi po niya nagagawa yung tamang function niya. So, we make sure that when we wear a mask, it really covers our nose, no? And fits snugly in our face. So the right way to wear a surgical mask, of course, blue side out or the color side out, white side in. And for those who are not wearing surgical mask, cloth mask, pwede naman, as long as it fits snugly in the face. Okay? And of course, made of at least 2 layers of cotton. Uh, yun naman talaga yung at least para maging safe tayo. Okay? So, also be ready, no, aside from the proper wearing of mask, also be ready with the first aid kit at home. So these are my tips na siguro if you have time, you prepare already your batteries, your BP app if you have paracetamol, okay, your supportive meds, thermometer. If you have a pulse oximeter, then it's actually better, no, para ma-monitor your oxygenation. Okay, if you have cell phone, computer, make sure that it can access online consults. No, this would be very helpful. And of course, I always advise my patients to do a symptom diary. So this is very important para lang mas makita natin accurately kung ano yung mga nangyayari sa kanila at ma-explain at mabigay ng tama at sa ayos yung mga uh, tamang medications. And I think this would be part of the new normal when we are running for our errands. No? So we be responsible for ourselves. Isipin natin kung kailangan ba talaga natin pumunta. Kinakailangan ba talaga? If kinakailangan talaga, then we must make sure that we are aware of the apat dapat, ano yung mga kailangan dalhin din. So you can bring a hand sanitizer, you can ensure that you are at least social distancing, no, you're practicing social distancing measures at all times. Your mask is always worn right, okay, and then of course you use reliable online resources if available. So of course the last part of my talk would be vaccination, because I'd like to stress that a lot of the reasons why our cases are already decreasing, it's not just because of the lockdowns and all. It's because of the steady vaccination that our government has been doing, no? Especially for NCR, who already has around 80 to 90%, no, of its people here vaccinated. So I'd like to stress that vaccination still is the best method to prevent COVID-19, and it continues to be safe and effective. And it can protect against severe disease. And in order for a community or a country to be protected, we must be able to establish the concept of herd immunity. So, ibig sabihin nito, hindi lang po tayo nagpapabakuna para sa sarili natin, kung hindi, para sa community po natin, para hindi rin kumalat. And, of course, kapag hindi po tayo nagkaroon ng severe disease or COVID-19, hindi po natin uh, mahahawaan at least yung mga pamilya natin, yung mga relatives natin, at yung mga nasa community. Okay? So, marami na rin progress with regards to our vaccination, and uh, for the vaccines that are available already in our country, those with EUA, so as written at the left, no, and we have already uh, given a lot, no, as of November 3, this was the data that total doses administered were around 61 million already. So this was already comprising our first and second doses. So during the time that we started our vaccination last March, the trend continues to be increasing. So we've continuously been vaccinating all of our priority groups. So priority being first would be your A1 or healthcare workers, next would be your senior citizens, and onwards on through the rest of the population. So what I'd like to highlight is that currently what we're actually busy about is our pediatric vaccination. So these have already started, no? So I think this week, no, it is already ongoing, and we've started to vaccinate even those without comorbidities already. So a lot of its benefits would be uh, due to the research studies, which it comprises direct benefits against COVID-19, and protecting these children will actually reduce the disease burdens, no, especially for adolescents. And there would be a reduction also in disruption of education by preventing disease. And this will actually encourage return of our regular pediatric care. So I'd like to remind that there are a lot uh, more diseases, no, especially with regards to immunizing our children, not just COVID-19. Okay, so also would be another important aspect that we're trying to see now is the concept of boosters. So a lot of studies already have been published, no, but it's not too many. But these studies actually looked at antibody titers and how the duration of the waning of these antibody titers. So we're also looking at homologous, meaning the same vaccine ang gagawin ng booster, or heterologous vaccines, no, as candidates for boosters. Up to now, there's no best combination yet that is established. The studies are still ongoing. We have to patiently wait for the science of it, since it still goes a rigorous process of evaluation. But this will still continue, since of course we have to patiently wait, and of course yung availability ng vaccines natin, okay, uh, are still limited, and of course meron pang mga factors with the continuous emergence of a lot of variants, no, so many studies would still be needed on COVID-19. Okay. So lastly, I'd like to tackle on COVID-19 stress-related factors. So this is actually very important kasi yun talaga eh. We have to incorporate, no, yung COVID-19 na yan, nandyan na yan. Okay? But the question is, how do we actually have a good perspective? Okay? Marami talagang napapastress sa atin. Of course, knowing that may COVID-19, maraming mga depressed, Okay, maraming na-expose, hindi alam yung gagawin. A lot of people have poor social support. Yung iba nawalan ng trabaho, nagkaroon ng sakit. Yung mga news, nasi-stress na sila, hindi na nila alam kung saan sila magbabasa. Okay, wala silang access to basic needs, naghiwalay-hiwalay yung mga pamilya. Marami talagang pwedeng maging stressors ngayon. But isa lang yung masasabi ko dyan, okay, number one tip ko sa inyo, okay, do not panic. Okay, wag po kayo mag-panic. Yun lang po talaga yung kalaban natin ngayon. Pag nag-panic, hindi natin alam yung gagawin. So, extreme anxiety can be your enemy when dealing with COVID. And we do not like that, okay? We like you to be informed early on so that you would know what to do. You would be calm and patient. You would be able to think what is right, okay? And ito po yung role namin as doctors to let all uh, the people informed, no, that these are the steps that need to be done para hindi po kayo magpanic. And of course, alagaan po natin yung mental health natin. And hindi dahil nagkasakit tayo, okay, hindi na tayo kikilos, okay, we should actually pag nagka-quarantine tayo, let's say na-expose tayo, ibig sabihin naman noon, ibig sabihin naman ay, of course, magpapahinga tayo, but we try to make the most out of our time. So, kung wala naman tayong nararamdaman, we find hobbies at home. Okay, dahil nga encourage them to always stay at home. We declutter, make open spaces that are available. Huwag po tayo mag-discriminate. Okay? These people, now especially those with COVID-19, need support and help, especially during this time. Uh, if kinakailangan ng gathering, baka pwedeng pakiusapan, no? Talagang kinakailangan ba? We should socialize smart. Okay, utilize natin yung mga video calls sa and Zoom meetings na meron tayo. So, of course, yun po yung mga bagay na kailangan natin tandaan. And next. Of course, yung important sa atin is actually we should stay fit, exercise, and eat healthy foods. So, yun po talaga. Kalaban lang natin dyan ng sakit kung mahina po yung katawan natin. Pero po, kung malakas naman tayo, maalalaban natin ng COVID-19 ng maayos. Okay? And ano ba? So prepare, prevention is always better than cure. Don't be too complacent. Okay, dahil lang po nagde-decrease yung cases, okay? Nandiyan pa rin po yung COVID-19, hindi rin po siya namimili, no? Kahit sino po pwede niyang ma-infect, okay? Have relaxation time, wag po kayong mag-overstress, don't overwork yourself. Okay, read on reliable sources and always verify with experts. Okay, so yun po yung kalaban natin, yung tama ba tong information ikakalat ko, i-verify ko kaya muna, we might be spreading the wrong information. So, lastly would be spreading the good news, no, means spreading good vibes. So, yun po talaga yung gusto kong message, no, with regards to this COVID-19. Which kailangan natin magkaroon ng healthy boundaries. Alam natin na, uy, tama ba? Safe ba yung pupuntahan ko? Kailangan ko ba talaga pumunta? If not, baka naman pwedeng next time. Okay, kailangan marunong po tayong makipag-communicate ng gano'n. And stay informed but not alarmed. So, keep an open mind. We know that a lot of developments would be coming out soon, especially on vaccines and boosters. Let's learn to be patient, no? Learn to wait for the recommendations and learn from every experience that, of course, learn from your experience, but also learn from the experience of other people with regards to dealing with COVID-19. So we are all part of the solution. Okay, we may be in the midst of the pandemic. Okay, but we all know that there are a lot of measures to prevent COVID-19, and we have vaccines. Okay, we have uh, we have our minimum public health standards to help us, protect ourselves against the virus. So, thank you very much. I hope you learned a lot from these COVID-19 updates.